Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about stroke. When I left off last week, I was in the middle of giving you some discussions as it relates to giving people aspirin who present with a stroke, etc. I want to continue that discussion, but I wanted to take a little bit more of time to tell you know that the European Association of Cardiology just had this huge meeting, annual meeting, and a lot of the stuff that came out had to do with strokes and the hypertension. And the new edition of JAMA, November 6th, of JAMA, number 17, most of that edition deals with hypertension and the report that came out of this European meeting. It's a good thing to take a look at. And again, they reemphasize the fact that the bulk of the people who suffer from, first of all, 1.13 billion people suffer from hypertension in the world, and then of that number, less than half are being treated properly. That is, that those who actually go for care, less than half of them are having the blood pressure control, which matches the same thing that's happening in this country, which I have reported on before and in my previous couple of shows that I did on stroke. It is a disastrous situation, and how one going to solve that problem, one doesn't know, because the bulk of the cardiovascular diseases in this country and across the world is a result of hypertension that's causing the stroke, the heart attack, the congestive heart failure, and so on and so forth. So, and of course leading to atrial fibrillation as well, because once you damage the heart because of the hypertension, one of the things that's going to happen, of course, is likely atrial fibrillation, etc. It is very, very important. And again, I emphasize the fact that an article came out on the AMA around on the internet last week that says that of all the developed countries in the world, more women died after giving birth than any other country, or any of the developed countries. And the reason given are three. They bleed to death, they have a clotting, or they basically cannot have the blood pressure control. Those three reasons. Uncontrolled blood pressure, bleeding, and clotting are the three things that's killing the women who died post-delivery. They give birth, they never get a chance to see the babies. But let me explain to you some of what is going on. Again, another article came out not too long ago in one of the major journals that said that when people have orthopedic surgery for their knees, those that are given aspirin, the aspirin is good enough to prevent them from having clot in the leg. Completely, totally false. Because people don't understand that two different types of clot. Clot is not just clot. Clot is a thrombus. There are two different thrombi. There's a white thrombus and the red thrombus. The red thrombus develop in the low flow system, which is the venous system, which is part of the extremities and so on and so forth. That's a low flow system. The white thrombus develop in the high flow system, which is the arterial system. Listen to this, and listen to this carefully. Okay, the reason why that is not true what they say about aspirin. Aspirin is a fantastic medication. I take my baby aspirin every day myself. Listen to this. The red thrombus has very little quantity of platelets in it. Very little quantity of platelets. It's mostly debris and red blood cell. So far, so good. Debris and red blood cell that's found in the red thrombus. And the red thrombus is what they would have given the aspirin for in order to prevent a clot. It won't work, because where is the amount of platelets in it to prevent the clot from occurring? Very little platelets in there. So that's the reason. The white thrombus, on the other hand, which is found in the arterial circulation, has white blood cell, tons of platelet, lots of platelet and white blood cell, and a few debris. That's what makes the white thrombus. So therefore, when you give aspirin for somebody like the aspirin that I take every morning, that would prevent me from developing a clot, because there's plenty of platelet there for the aspirin to disaggregate, prevent the clotting from occurring. You understand that? So therefore, that's why this is completely, totally bogus. And yet, they publish that stuff and they're treating people. They're going to give people aspirin after surgery to prevent clot. Furthermore, the situation is worse than that. The vast majority of people who develop the clot that can cause them to die, the clot has nothing to do with aspirin. It's not a platelet-based mechanism. So aspirin will not work to begin with. Example, just this past couple of 2, 3 weeks, I admitted 2 patients on an unnamed hospital. This is confidential stuff. I will never name the patient, but I'm giving it as an example. I'm living it right now. This is not an abstraction. One patient comes in because this particular patient had a clot in the leg. Okay, fine. I decided to admit that patient anyway because of the patient's age to treat the clot on their legs inside a hospital. As I'm writing my orders to admit the patient, out of the blue, I decided, based on my experience and judgment, why don't I also look at the patient's lungs to see if this particular patient have clots in the lung. Patient had absolutely zero symptom of cardiopulmonary problem, none. No tachycardia, no shortness of breath, no chest pain, no elevated, nada, not even a cough. But I decided to do it anyway. Listen to this. As soon as I admitted the patient, I decided, let's get a CT angio, which is the test that you would do to see if the patient had a clot in the lung. Are you ready for this? This particular patient that has no cardiopulmonary symptom had 2 clots in the right lung and 1 clot in the left lung. How about that? So that's patient number 1. Patient number 2, who I just discharged a few days ago, again presented because this particular patient showed up in the office with a swollen leg. I said, fine, I bet you have a clot. Send the patient to this unnamed hospital. An ultrasound was done. There was a clot. Fine. I'm going to admit that patient, which I did. In the process of writing my orders to admit that patient, again, based on my experience and judgment, I decided to check the patient's lung as well. Totally, completely no symptom of any pulmonary cardiac problem of any kind. Guess what? The same thing. This particular patient wound up with 2 clots in the left lung, 2 clots in the right lung. How about that? And then the vast majority of people who die in this country, they can't find the cause of death. When they do the autopsy, guess what they find in the lungs? Pulmonary emboli. That's what killed them. How about that? So, and the reason is, I give you the 2 examples. The first patient I described to you winds up having this thing right here, an extremely high lipoprotein A level right here. That's why this particular patient clotted. Okay. The next patient that I admitted, who I just sent home a few days ago, had a decrease right here. See the homocysteine? Homocysteine was super high right here. Elevated homocysteine that can cause you to clot. Fine. And then I said, well, because I did all these things, so-called hypercoagulability. In addition to that, this particular patient also wind up having a low antithrombin 3 right here. The antithrombin 3. You have to understand something. Heparin is really not an anticoagulant. Time out. And they say, oh, what is Valsa? Because without antithrombin 3, heparin will not work. So heparin really, without thrombin, heparin is useless. Even though we make the heparin ourselves in the cell, in the mast cells in the gut, but without antithrombin 3, it won't work. So therefore, you need antithrombin 3 to make heparin work. And it is the heparin then that causes the blood to remain liquefied. So therefore, that's why this other patient clotted as well. Now, to make matters worse, I decided, well, you know, if one has low folic acid, your homocysteine can go up. Why don't I put the patient on folic acid? I did. High dose folic acid. 4 or 5 days later, the homocysteine went even higher, which meant that this patient was actually born. This patient is heterozygote for homocysteinemia. That's a hereditary condition. How about that? Okay? So when you have all these patients walking around there with all these problems that I check off, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, all these things, these are the reason why these women that have given birth are clotting. And has nothing to do with aspirin. Not a single one of these things will aspirin prevent clotting. And yet, 20% of the U.S. population has elevated lipoprotein A, which is produced in the liver. Let me give you the mechanism, okay? Now, I'm not faulting anyone. You have to understand that. I went to one of the best medical schools in the country, top 20 medical school. I went to one of the best training programs. I had fantastic teachers. But this knowledge was not available to them so that they could have taught it to me. All this stuff I learned on my own. On my own. I'm practicing clinical medicine. I went to the fantastic training program, great medical. 85% of what I do every day in my practice of clinical medicine, I taught myself. Okay? So, one of my colleagues said this morning, Val, you're just not just a doctor, you're also a fantastic, excellent scientist. I said, well, thanks for the compliment. I could use that compliment this morning. Because you got to understand something. You have to take the time to learn. There's nothing wrong with these physicians. They are great doctors, excellent doctors who are doing the best they can. 70% of the medicine that's practiced in this country, 70% is practiced in the community. So these men and women are doing the best they can. They're working very hard 24/7, providing medical care for the communities that they're involved with. I'm not criticizing them, but they had nothing to do with this. People who knew them, who taught them, knew nothing about this. This is recent. Of course, this thought existed, but we didn't know anything about it. Just because we didn't learn it when we went into training doesn't make it unreal. So telling me that, look at all this stuff that's causing people to clot. Not a single one of them would aspirin would have prevented, because it's not an aspirin, it's not a platelet-based mechanism. Aspirin only works to prevent stroke and other clotting if platelet is involved, because the aspirin can prevent the platelet from aggregating. Okay? So all these things right here, look at all this stuff. 12 of them that I pointed out to you in the yellow. Not a single one of these things will the aspirin do anything to help. You understand that? Aspirin is fantastic. Aspirin is an analgesic. It's good for pain. It's an anti-inflammatory, and it's an anti-fever. So if somebody has a fever, you give them aspirin, it's going to bring the fever down. Somebody is having severe pain, you give them aspirin, it's going to help the pain. Across the world, more people are using aspirin to treat arthritis than anything else, because that's what they can afford. Because across the world, the cheapest thing you can get your hand on to buy to treat arthritic pain is, of course, aspirin. Some people cannot afford the NSAID because the NSAIDs are too high. And some countries don't even, they're so poor they don't even have the NSAID in great demand. So those people who have money there can find it and buy it, but poor people can't, so they turn to aspirin. Aspirin is cheaper. And it's a fantastic medication. But let me explain to you the mechanism why this thing will cause people to clot. We have two substances that keep blood liquefied: heparin and plasminogen. Let me repeat that. Heparin and plasminogen are the two substances that keep our blood liquid. Otherwise, it would have clotted 1, 2, 3. However, when one has, let's take the example of lipoprotein A. Lipoprotein A itself, working in concert with LDL cholesterol, can take over the system under stress and push heparin and plasminogen aside, render them inefficient, and then you clot just like that. So for now, you understand, a whole lot of folks that are traveling all over the world, and then when they landed, they got a clot. A whole lot of people who had surgery, and then they lay down on the bed, and then they develop a clot. I mean, all these people, if one were to test them, you're going to find that they have an abnormality similar to this, and that's caused them to clot. And why are you giving them aspirin? They just had surgery. They're not going to clot properly because you give them aspirin. What is the aspirin going to do for them? Nothing, other than cause them to bleed. However, if you do a search prior to do surgery to this individual, you found that they have a thrombophilia. Thrombophilia is one, when anybody has any one of these things, we call that thrombophilia. Then you understand thrombophilia is not treated with aspirin. And therefore, by preparing them, giving them Lovenox, heparin, then or any one of the factor 10 inhibitors, then you will prevent them from clotting. But is this being done? No. I left the show last week with the last statement. I was talking about why you give somebody 2 aspirin. And I said it was not a smart thing to do for several reasons. One of the main reasons, take a look here. This is the test we do for von Willebrand. You say, well, what is von Willebrand disease? Von Willebrand disease is the #1 bleeding disease in the world. 110 million people across the world suffer from von Willebrand, which is a qualitative platelet abnormality. The platelet quality is bad, so therefore they will not aggregate properly. And I said last week, and I'll say it again, 25% of women that are having severe menstrual bleeding across the world turns out to be not because of fibroid or some other reason, because they have von Willebrand disease. In this country, 3.2 million folks suffer from von Willebrand. And thousands of other people have hemophilia A, hemophilia B. All these folks are aspirin contraindicated. How about that? And you have a whole lot of people who have, let's say, essential thrombocythemia, where the platelet is actually high, and yet aspirin is contraindicated. How can you have 700,000 platelet and a disease, and I'm sitting here telling you aspirin is contraindicated? Because the platelets are abnormal. They can cause bleeding to occur. The higher the level of platelet and essential thrombocythemia, the more likely possibility that the patient may actually bleed. How about that? So is it my fault that I know these things that other people don't? Is it my fault that I'm saying 2, 3 o'clock in the morning, reading, writing, and I'm supposed to apologize for that? Give me a break, okay? That's what I choose to do. That's what I enjoy doing. That's what keeps me going. So I'm not here to criticize anybody, but you got to understand this information exists. I just give you 2 examples of 2 patients. Last week, I spoke to 2 other patients that had prostate cancer that was being put on hormone to decrease the size of the prostate gland as part of the treatment of the prostate cancer. Both of these patients, I tested them. One of them has 2 of this abnormality. One of them has elevated lipoprotein A. I had to rush quickly to put them on Xarelto because they were going to clot, because they were taking a hormone. That's a male hormone. And the reason why most of these women clot when they're pregnant and they deliver their baby, because the one hormone that can cause them to clot if it's in their system happens to be estrogen. And the woman cannot carry a pregnancy to term unless she's got a high level of estrogen. So now she's lying on the bed. She just had a baby, okay? She's lying in the bed. She's immobilized. And level of estrogen is still high. She just was under stress. I just finished telling you, remember that. When you are under stress, lipoprotein A can quickly push plasminogen and heparin aside and take over. It happened under stress in particular. And what could be more stressful when a lady is having a baby? I mean, I give women $1 trillion credit that not only they're able to carry a baby, and then they're going to have all this stress, and then you let them lie in the bed after they deliver the baby. You had no clue that they had elevated lipoprotein A, 20% of the U.S. population, because you never tested them for it, and then they clot. You say, oh my God, I don't know why they clot, and these poor women are dying. Okay? I have one guy in my office whose lipoprotein A was like 152. I remember the number, 152. I've never in my career before had to prophylax anybody with their lipoprotein A that low. And the gentleman is going a 4-hour trip from here to St. Lucia. 4-hour trip to visit his family. Coming back from St. Lucia, the guy landed at Kennedy Airport with a big clot in his lung and a big clot in his leg. He almost died. And they tried to assist him. They said, no, Dr. Alcena is my doctor. I got to get to White Plains. Please get me to White Plains. And then the doctor who assisted called, they got him here, and the man with something, the normal lipoprotein is less than 70. His was 156 for a 4-hour trip from St. Lucia to Kennedy Airport. The man clotted. Clotted. Almost died. So I learned something. Because usually I prophylax people when they're driving, when they're going from here to Europe, they're going to Asia, blah, blah, blah. I give them, and I give them Levinox prescription to inject them before they go, inject them before they come back. I do it all the time. If they're driving from here to the south, a 12-hour, 18-hour trip, they're going to California, I prophylax them as well. A 4-hour flight for 152, this guy clotted, almost died. And this is stuff that I'm doing and seeing, and I'm not going to sit here and apologize for this. If people want to keep up, the literature is right there. Go read it. I have about 8 to 10 journals I receive every week, and I read all of them, inside out, because I'm a writer. I have to write these books, 136 chapters from the top of my head, because I read the literature. So this stuff is real. So getting back to stroke thing, so this is not just the hypertension that can cause people to stroke, because that the elevated pressure damages the lining of the vessel, as I mentioned before, which was again explained in JAMA yesterday that I read it, part of the European Cardiology Association meeting in Europe. Yes, it's terrible. Yes, I also mentioned the concept having to do with atrial fibrillation. If you don't have, okay, a valvular heart abnormality, then you take an aspirin for your atrial fibrillation, you're okay, because the aspirin will disaggregate the platelet plug that sits in the atrium when the heart is doing this. The disaggregation prevent the heart when it starts pumping again like this to shoot to your brain and cause you to have a stroke. Okay, and the reason why I said last week that the 2 aspirin was too much is because not only because you have people with this level of von Willebrand, somebody might present with von Willebrand. 25% of people who have hemophilia as an adult develop it spontaneously, in case you didn't know that. And nobody bother to know just because somebody have a stroke, they didn't bleed, which is fine. But you don't know what they have on the line, and you can give them 2 baby aspirin. The more aspirin you give them, in order for the aspirin to cause the platelet to disaggregate, it must pass through thromboxane A2. That's the process. So the more aspirin you give, the more you activate thromboxane A2, and the more thromboxane A2 secretes a tremendous amount of material. By necessity, it must do that. And all this material that the thromboxane A2 secrete happen to be vasoconstrictors. That's right, they're all vasoconstrictors. So what you're trying to achieve is to prevent the clot. Fine, I can understand that. But you also don't want to eliminate prostacyclin, which is the God-given vasodilator that is found in the lining of the vessel. You want to take advantage of that. You want to keep that working for the patient. And furthermore, 81 milligram of aspirin is sufficient to render the entire platelet in the body to become qualitatively abnormal for 7 to 10 days. 7 to 10 days. If you give someone 81 milligrams of aspirin for 7 to 10 days, the platelet quality is abnormal. They will not aggregate properly. So why too much aspirin? What are you trying to prove other than making the patient bleed more, give the patient ulcers and whatever, and make the patient's situation worse? Because the more aspirin you give, the more the vessel will constrict because of what I just explained to you, okay? So this is stuff that is right there, and don't expect me to apologize for knowing it. If you know, that's your business. The literature is there. My responsibility is that of my patients, and also to teach my students and those that I'm responsible for to provide medical care for. And I come here to do the show to help you so that you can understand this stuff, not to criticize anybody, not to pontificate, but don't expect me to sit here and apologize because I have knowledge. Knowledge is power. And if I didn't have knowledge, unknown to you, I wouldn't be sitting here. They would have taken my license away a long time ago, because they try very hard. They try everything for doing absolutely nothing, because I happen to have dark skin and God give me an extremely high IQ, and I am somebody who speaks my mind. So because of that, I must be gotten rid of. And they did everything. If they tell you there was a single thing that one human being can do to another that they didn't do to me, they're lying. They're all losers, because I beat them to a pulp, literally. I don't mean physically. I mean, they couldn't touch me, because these people don't know half of what I know, and I doubt very much if some of them have a third of my IQ, and yet they're in charge. That's the system. They're in charge. So because of that, they think they can get it. They'll learn that they cannot. They cannot. In fact, the state won't let them either, because the state has already put a tag on me. Okay? A giant and a legend. That's what the state say about me. Don't touch him. Okay? So suffice it to say then that if you're going to treat these people, which you must, then you have to know how to do it. Let me give you an example. There's a part of the stroke syndrome called transient ischemic attack, TIA, which could be a prodrome to a real stroke, which is quite common, because 90% of folks who are having microvascular disease is the result. They've had hypertension, blah, 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 and the vessel get damaged, the platelet can't pass through properly, and they get plugged, and the oxygen transiently get cut off, they black out, they have transient ischemic attack. There's one company that is very smart that I give credit to. That is the company that make the drug called Agrenox. The Agrenox is to disaggregate the platelet so that the vessel can be open, blood can go through, oxygen can be delivered to treat the TIA. Get how much aspirin is in each pill? 50 milligram. Dipyrimidol is a vasodilator, 200 milligram. 50 milligram is so this is a very smart company. They know exactly what to do, because they do not want to prevent the blood from going through. Only 50 milligram. So 50 milligram twice a day, dipyrimidol 200 milligram twice a day. That's the treatment. That's what Agrenox is. So there's a smart company, and I compliment them. They understand platelet physiology. 50 milligram on each tablet. So for the entire day, the patient gets 25, 25. 25, 25. 25 milligram in one pill, 25 milligram on the other, 50 for the entire day. And they do extremely well. How about that? That's how we treat transient ischemic attack, to prevent from having a real big stroke. Listen, I'm going to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.